Many of my patients that I talk with remember when they first noticed the change in their eyesight. Maybe it was reading the newspaper and realizing the words in the center of the page looked slightly wavy, or it was driving and noticing that the traffic light looked blurred even though the ones on the side were clear. Or it was looking at someone's face, someone you have known for decades, and seeing a shadow where their eyes or nose should be. And then there was the appointment, the diagnosis, macular degeneration, age-related macular degeneration, or AMD. And then for most of our patients, the sentence that follows the diagnosis: there isn't a cure, we can try to slow it, we'll monitor it closely, come back in 3 months. If that experience sounds familiar, if you are one of nearly 20 million Americans living with macular degeneration, then this episode is specifically for you. Because I want to do two things today. I want to explain what is actually happening in your eye in a way that makes real sense. And I want to tell you why, for the first time, there is a treatment option available here in the Gulf Coast that addresses the macula directly in a way that conventional medicine does not. I'm Dr. Rebecca Gibbons at Acupuncture. I'm Dr. Rebecca Gibbons at Acupuncture and Wellness of Pensacola. So, what is the macula and what does AMD actually mean? Many patients have heard macular degeneration for years, but don't fully understand what the macula is, diagnosis, and what your options are. Your eye works a little bit like a camera. Light enters through the lens at the front of the eye and is projected onto the retina, the light-sensitive tissue lining the back of the eye. The retina contains millions of specialized cells. There are two types: rods, which handle peripheral vision out here, and low light vision, and cones, which handle color and the fine detail. The macula is a small but extraordinary important area at the center of the retina, roughly the size of a pencil eraser. It contains the highest concentration of cone photoreceptors in the entire eye. The macula is responsible for your central vision, what you use to read, to recognize faces, to drive, to see detail. Everything that you look at directly goes to the macula. Macular degeneration is the deterioration of this area. As the macula degenerates, photoreceptors that in the region start to lose their function and die. The result is the gradual loss of the central vision, the blurring, the distortion, and the missing spot. Your peripheral vision typically remains relatively intact, which is why most AMD patients can still navigate a room and see the edges of things. But the detailed central vision is where macular degeneration takes hold. Slowly, relentlessly, it deteriorates. Macular degeneration is the leading cause of irreversible vision loss in adults over 50 in the developed world. Nearly 20 million Americans are affected, and that number is expected to double by 2050. It is not rare, it is not unusual, unfortunately. And yet the conversation around meaningful treatment remains profoundly limited for the majority of patients. So let's look at dry AMD versus wet AMD. Macular degeneration comes in two forms, dry and wet, and the distinction between them matters significantly for understanding what conventional medicine can and cannot offer. And this is where AcuNova fits in. The most common form is dry AMD, and it accounts for approximately 85 to 90% of all macular degeneration cases. It develops gradually, often over years or decades. The hallmark of dry AMD is the accumulation of small deposits beneath the retina. It's waste products from photoreceptor cells that the body fails. These deposits damage the retinal pigment epithelium, the layer of the cells that support and nourish the photoreceptors, and gradually the photoreceptors themselves begin to deteriorate and die. Dry AMD typically moves through stages early, intermediate, and advanced. In its early stages, many patients have few or no noticeable symptoms. By the time vision changes become significant, meaningful structural damage has already often occurred beneath the surface. In advanced dry AMD, a condition called geographic atrophy can develop where large areas of the retinal pigment epithelium and photoreceptors are lost entirely, creating blind spots that expand over time. So, wet AMD is less common but faster progressing with more active treatment options and more limitations. Wet AMD, also called neurovascular AMD, accounts for roughly 10 to 15% of cases, but is responsible for the majority of severe vision loss from AMD. In wet AMD, abnormal new blood vessels grow beneath the retina. These vessels are fragile and often leaky. They bleed and leak fluid into and beneath the retinal tissue, causing rapid distortion and destruction of the macula. Wet AMD can progress very quickly, sometimes causing significant vision loss within days or weeks rather than years. This is why AMD patients are treated so urgently. The primary conventional treatment for wet AMD are injections, medications injected directly into the eye that suppress the growth of those abnormal blood vessels. Drugs have genuinely changed the progress for wet patients. It can slow progression significantly. And this is a real advancement in treatment, and it is very important. It is important to note on that fact for wet AMD patients that AcuNova treatment is not a replacement for anti-VEGF injections. It is a complementary approach that addresses the underlying vascular and inflammatory environment that injections do not reach. Wet patients choose to pursue AcuNova alongside their injection schedule. We always coordinate with that with your existing ophthalmology care and discuss this thoroughly at your consultation. So I want to be direct about something. The core limitation of conventional AMD treatment is that it is almost entirely focused on stopping or slowing damage, not on supporting the health and function of the tissue that remains. Anti-VEGF injections block abnormal vessel growth, supplements provide antioxidant support, monitoring catches progression early. These are very valuable. But I want to also point out that none of them address the fundamental physiological environment that drives macular degeneration forward. None of them improve the microvascular circulation that feeds the macula. And none of them reduce the chronic low-grade inflammation in the retinal environment that contributes to photoreceptor loss. None of them support the retinal pigment epithelium in performing its essential job of clearing waste and nourishing the photoreceptors above it. So the gap is not in what ophthalmology does, the gap is what it doesn't and currently can't do with its tools. This is not a criticism of ophthalmologists. They are working with the tools of the medicine that has been developed, and those tools matter. But for the vast majority of AMD patients, particularly those with dry AMD, those tools amount to take the vitamins to protect your eyes, come back in 6 months, and hope it doesn't progress faster than expected. This is a deeply unsatisfying answer for many of those with AMD. It is precisely why patients with AMD make up one of the largest groups seeking integrative care worldwide. They are not being difficult or naive, they are being human. They are looking for something more, and they are right to look for something more. So let's review what conventional AMD does not address. So it does not address macular microcirculation, retinal inflammation, photoreceptor survival support, the underlying vascular environment driving degeneration. This, where they fall short, is where AcuNova enters the conversation. And I want to explain specifically, not vaguely, what it does and why it addresses this gap I just described. So the AcuNova protocol was developed by Dr. John Boll in Denmark specifically for degenerative eye conditions. The needle points are not your standard acupuncture points. They are precisely a mapped system developed through decades of clinical work, targeting the neurological and vascular pathways that influence retinal and macular function. So let's talk about what the treatment does for the macula and why it matters. So, one, it improves microcirculation to the macula, the tiny blood vessels that supply the retinal pigment epithelium and photoreceptors with oxygen and nutrients that are compromised in AMD. It reduced in both density and efficiency over time. AcuNova stimulates increased blood flow through these vessels for macular tissue that has been starved of what it needs. Restoring circulation is not a small thing. It is addressing the root of the problem. It reduces inflammation in the retinal environment. Chronic low-grade inflammation is increasingly recognized as a central driver of AMD progression. The accumulation of drusen triggers an inflammatory cascade that accelerates damage to the RPE and photoreceptors. Acupuncture has been well documented as an anti-inflammatory effects and its influence on the immune system. Paired with how specific the treatments of AcuNova is, this can reduce the inflammatory burden in the macular environment and addresses something no other drugs can. It supports the retinal pigment epithelium, or the RPE. The RPE is the layer of cells responsible for clearing waste, recycling visual pigments, and nourishing the photoreceptors above it. In AMD, RPE dysfunction drives much of the photoreceptor loss. So by improving vascular supply and reducing inflammatory stress, AcuNova creates conditions in which these cells can function more effectively and potentially survive longer. So what does this mean in practical terms for AMD patients? For early to intermediate dry AMD, AcuNova may slow progression meaningfully and in some cases stabilize vision, preventing further loss while supporting the health of remaining macular tissue. For advanced dry AMD or geographic atrophy, the focus is supporting remaining photoreceptor function and slowing the progression of atrophy. Some patients in this group report improvements in contrast sensitivity and light adaptation, even in advanced stages. For wet AMD, alongside anti-VEGF treatment, AcuNova addresses the vascular and inflammatory environment that injections do not reach. Many wet AMD patients report that combining injection therapy with AcuNova produces better stability than injections alone. So, I want to be honest about what results look like because macular degeneration results are very individual. In some patients, we see measurable improvement in visual acuity. In others, the improvement is in contrast sensitivity or reduced distortion or better vision in low light. In others, particularly more advanced cases, the result we are most proud to confirm is slowing the progression at the patient's next ophthalmology visit. Not every patient experiences the same outcome, but the consistent finding across thousands of AcuNova patients internationally is that something meaningful happens, something that monitoring and vitamins simply cannot produce. So the AcuNova protocol for AMD is delivered as a 2-week intensive, 2 treatment sessions per day over 10 consecutive treatment days. This is how the protocol was designed to be delivered and how it produces the best result for macular conditions specifically. The reason is the sensitivity of the retinal tissue. The macula requires a sustained, concentrated level of therapeutic input to produce measurable physiological response. The concentration of sessions over 2 weeks creates a therapeutic momentum that spreading sessions out over months, it just simply can't replicate. So each session is comfortable, approximately 30 to 40 minutes, completely non-invasive, no needles in the eye, and most patients find them deeply relaxing. And for patients traveling from outside Pensacola, which many of our eye patients do, we are glad to help you think through the logistics of the stay. This treatment is simply not available in most of the country, and we understand that and try to accommodate you as best we can. If you have been diagnosed with macular degeneration, dry or wet, early or advanced, and you want to know whether AcuNova treatment is appropriate for your specific situation, the next step is to have a conversation with me. So you can call us at 850-530-1028, and my assistant will schedule you for an in-person or over-the-phone consultation. We'll review your diagnosis, your current treatment plan, and I'll give you my best honest clinical assessment of what AcuNova is likely to offer you. Or you can visit awpensacola.com to learn more about us and what we offer. We serve patients from Pensacola, Gulf Breeze, Fort Walton, and Southeast Alabama and beyond. And for the eye intensive treatment, we also welcome patients traveling from all over the country and internationally, because this treatment is simply not available in most of the country. So in the next episode, we're going to talk about retinitis pigmentosa, and a condition that is rarer than AMD, but where conventional medicine has even fewer answers, and where AcuNova has produced some of the most extraordinary results. So subscribe so you don't miss it. Thank you so much for giving me your time. Have a great rest of your day.